Okay, everyone, good afternoon. I'm David Van Slyke, and I have the privilege to serve as the Dean of the Maxwell School of Citizenship and Public Affairs. It's my pleasure to welcome you to the 33rd Annual Herbert Lourie Memorial Lecture on Health Policy. And it is so great to see so many of you in person. Hard to believe that we're able to say that, and it's just wonderful to be here with you. I'd like to acknowledge with respect the Onondaga Nation, the firekeepers of the Haudenosaunee, the indigenous people on whose ancestral lands Syracuse University now stands. The Lourie Lecture is held in honor of Dr. Herbert Lourie, who is a distinguished physician and a member of the national and international medical communities in the field of neurosurgery. Dr. Lourie was a physician who understood medicine as a high calling that demands the utmost of skill, intellect, compassion, and character. This lecture series is a wonderful opportunity to bring our community together with a distinguished and thoughtful individual who is involved in the issues that animated Dr. Lourie's life. First, I'd like to thank the Central New York Community Foundation for their generous funding that made this lecture series possible, and of course to the Lourie family for their abundant support throughout the years. I also want to thank the Center for Policy Research and the Lerner Center for Public Health Promotion for hosting the annual Lourie Lecture. CPR is home to nationally and internationally recognized scholars who conduct a broad range of interdisciplinary research and other activities related to public policy. It also houses the Lerner Center for Public Health Promotion, which Professor Shannon Monnett directs. And so now I'd like to introduce you to the Lerner Center for Public Health Promotion, Dr. Shannon Monnett, who will also introduce the 2021 Lourie Lecture, Dr. Mona Hanna-Attisha, a pediatrician whose personal experience and research brought the fight for justice in Flint, Michigan to the national spotlight. In addition to a role with the Lerner Center, Shannon is an associate professor of sociology in the Maxwell School and also the co-director of the Policy, Place, and Population Health Lab as part of the Aging Studies Institute. Shannon?
Thank you, David. My name is Shannon Monnett. I'm the director of the Lerner Center for Public Health Promotion and also an associate professor in the Department of Sociology. The Lerner Center for Public Health Promotion is a center in the Maxwell School that conducts, coordinates, and promotes community and population health research, education, and outreach. And together with the Center for Policy Research, we coordinate this annual lecture. I'd like to express my gratitude to Laura Walsh for coordinating the logistics of the event and to the Center for Policy Research for all of their assistance in bringing this together. Laura will be monitoring the questions in the chat box during the live stream, and after an initial discussion, we'll open it up to Q&A from the audience. We're thrilled that Dr. Mona Hanna-Attisha is with us today. Dr. Mona Hanna-Attisha is a pediatrician, scientist, activist, and author. With a concentration in environmental health and health policy, Dr. Hanna-Attisha received her bachelor's degree and master's degree in public health from the University of Michigan. She completed her medical degree from Michigan State University College of Human Medicine and her residency at Children's Hospital of Michigan in Detroit, where she was chief resident. She is currently a Charles Stewart Mott Endowed Professor of Public Health and an associate professor of pediatrics and human development at Michigan State University College of Human Medicine. She's also the founder and director of the Michigan State University and Hurley Children's Hospital Pediatric Public Health Initiative, which is an innovative and model public health program in Flint, Michigan. As if she didn't have enough to do, Dr. Hanna-Attisha is also the author of a widely acclaimed and best-selling book, What the Eyes Don't See, a story of crisis, resistance, and hope in an American city. In it, she provides a firsthand account of the Flint water crisis and how she used science and advocacy to prove that kids in Flint were being poisoned by lead. The book explores the horrific reality of misguided austerity policies and callous bureaucratic indifference which place an entire city at risk. And it highlights Flint's and our own country's history of environmental injustice. Dr. Hanna-Attisha has testified multiple times before U.S. Congress and was awarded the Freedom of Expression Courage Award by PEN America. She was named one of Time Magazine's 100 most influential people in the world and recognized as one of USA Today's Women of the Century for her role in uncovering the Flint water crisis and leading recovery efforts. And in 2020, she received the Freeze Prize for improving health. She's also a frequent contributor to national media outlets, appearing in New York Times, Washington Post, CNN, MSNBC, BBC, and countless other outlets, where she champions the cause of children in Flint and beyond. She's the founding donor of the Flint Child Health and Development Fund, which to date has invested over $11 million in programs aimed to address and mitigate the impact of lead poisoning and trauma suffered by children in Flint. Please join me in welcoming Dr. Mona Hanna-Attisha.
I'm smiling, waving. It's great to see you.
Welcome. Thank you so much for joining us, for making the trip here, for coming through the rain to be here at SU today.
Thank you.
So we're going to chat about your book, and then we'll open it up to the audience. But I'd just like to start a little bit with your background, if you don't mind, because it plays such an important role in your book. So you write about your background as an environmental activist. Activism and resistance seem to be part of your family history. And your childhood seems to have informed your orientation to fighting for social justice issues. So can you tell us a little bit about your background and how it informed your approach to investigating and uncovering the crisis in Flint?
Thank you. That's a great question. And when I set out to write a book, which I never thought I would do as a pediatrician, it was just going to be like a firsthand account of being in the middle of this emblematic environmental and public health crisis. And that was the book I was going to write. And then as I started to write that book, I'm like, wait a minute, I can't really tell you like what I did without telling you like who I am and where I came from. So very much kind of my background is in this book to give you the perspective of kind of my roots in social justice and advocacy. And embedded in this book is all these kind of little vignettes, and a lot of it is kind of family history and oral history that was passed down for generations. And I'm just going to share two quick stories. One is about my great uncle Lourie. And as a kid, like I'd always heard about my great uncle Lourie, and that he was always like on the run from officials, and he had a list of fake names because he was always fleeing the cops, and he was always fighting for like one cause or the other. And he had gone to school here in the States. He came to MIT in the 1930s, and he was kind of so excited by the activism that was happening during that time that he got kicked out of school, and he was sent back to Iraq, where we're from. And while he was there, he started a group called the Association Against Imperialism and Fascism. Like, I would sign up and join like that group right now. And he went on to one kind of freedom fighting cause after the other. He went to Palestine to fight for Palestine's independence from British rule. And then he found his way as one of two Iraqis that went from Baghdad to Spain to fight in the Spanish Civil War against Franco and the Nazis in the beginning of World War II. And because he had spent a little bit of time in America, like for some reason, they included him in the Abraham Lincoln Brigade with all these other Americans that had gone over to Spain to fight in this as part of the international brigades. It's like a quintessential fight for freedom. And like, so these were the stories of my childhood. And he also had a tattoo, which I thought was amazing, where my parents would tell me stories about my great uncle. So, you know, I was raised in this milieu of storytelling and family history where, you know, it wasn't about race or religion or country, but it was about doing the right thing, no matter how hard that was. We are immigrants. I wasn't even supposed to be in this country, came here when I was 4, and that immigrant perspective also very much kind of shaped who I am and what I went into. Like I grew up every day grateful to be in this country. I had first cousins back home in Iraq undergoing sanctions and war after war and air raids and, you know, food shortages. And I knew how lucky that my family and I were absolute recipients of that American dream, but also acutely aware of what bad people could do to vulnerable populations. Another quick story that I share in the book is about a photo that my father shared with me when I was 10 or 11, and it was the massacre in Hanna-Attisha, a chemical weapons attack, when Saddam Hussein woke up one day and decided to poison an entire city, and 5,000 people died that day. And I don't think my dad should have showed me that picture. Like, I was like really young, but he did. They never shielded us from what people in power could do to vulnerable populations. And that's, those are the things that shaped me and almost gave me this heightened antenna for injustice, pushed me to service, pushed me to medicine, pushed me to policy, pushed me to working in places like Flint, where this happened.
Thank you. That's very powerful, and it weaves throughout your book in a super interesting way that I think really adds flavor to the story. So I think most people in the audience probably know that lead is bad for us, that we shouldn't be consuming it. But can you give us some specifics? So what are some of the risks that are involved in lead consumption, especially for children?
Yeah, that's a great question. So lead is bad, right? So what would you guys tell me when we try to make this as interactive? What did we put lead in? What was paint? Good. What else? Gasoline. What else? Pesticides. What else? Pipes. Good. Plumbing. So I don't know, any science majors out there? What's the elemental symbol for lead? Pb comes from the Latin plumbum. So lead actually means plumbing, which I didn't know until going through the story. What do we still put lead in? Do you guys know? So it's still in like makeup. What's that? Fishing rods, fishing stuff, yeah, absolutely. Bullets. So I've taken care of patients with lead poisoning because they've been shot and the retained bullets continue to leach lead. Lead is still an aviation gas, so it's still in the plane I took this morning probably had lead in gasoline. So even though we know that lead is bad, it's still in a lot of things. And so is it still in paint and gasoline? No, we passed some really amazing laws that restricted the use of lead in things like paint and gasoline and finally in plumbing. But it's not like when we passed those laws, we immediately got rid of that lead, right? Because underneath layers of paint, there's layers with lead in them. And underneath kind of soil, especially along roads and highways, there's lead deposits. And then in our drinking water infrastructure, there's lead throughout. Lead wasn't banned in our service lines, which are the pipes that go from water mains to the front of your house until 1986. And lead wasn't restricted in like brass fixtures and faucets until, get this, 2014. So we can spend like hours just talking about the lead industry and the power that they had, and how we were stubbornly slow as a nation to listen to science when we implemented these policies. And we don't use lead as much, it's still out there, but we live with its lingering legacy. And over the last few decades, we have increasingly come to understand why lead is so bad, and why the CDC and the American Academy of Pediatrics and the World Health Organization, why we've come to understand that there is no safe level of lead. Levels we thought were okay, even when I was a training doctor, like 20-ish years ago, we now know are no longer okay. Not any level has been shown to be safe for children because of what it does. It impacts cognition, so it actually lowers IQ levels. It impacts behavior, leads to things like attention disorders, focusing problems, criminality. It's been linked to criminality and oppositional defiant disorders, growth problems, hearing problems. Kids exposed to lead as adults and seniors can manifest with things like high blood pressure and kidney disease and gout, and even things like early dementia. So it has this life course altering impact. And what we're supposed to do in public health for lead is this concept of primary prevention, which means we're never supposed to expose children or a population to lead because it's potent, it's irreversible, and once again, it has no safe level. And the other kind of damning thing with lead is that even though the burden of lead exposure has decreased significantly because of these amazing policies that we were too late to pass but still passed, the burden of exposure does not fall equally on our nation's children. And I'm sure we'll talk more about environmental justice and environmental racism, but lead is a classic form of environmental racism. Kids in places like Flint, Detroit, Chicago, Philadelphia, Baltimore have much higher levels of lead exposure than other children.
So I'm glad you brought that up because that transitions nicely into the next topic that I wanted you to talk about, which is the history of Flint and the role that that played in the poisoning crisis there. So many people in the audience, I'm sure, know a lot about the background of racial residential segregation, the auto plant closures, austerity budgets. So those things came up in your book. Can you talk a little bit about the role that that history played in developing this crisis?
Absolutely, and I think you guys will appreciate this more than other audiences, but history is so important. Like, I think if we understand history, we if you understood Flint history, you could have predicted the crisis. We step over history every single day, and it informs kind of where we are and where we need to go. And too often, I think we kind of close our eyes to history, especially anything dark and complicated. But it's especially important in this story. So we'll shoot it back out to you guys. So you guys tell me, what was Flint famous for a long time ago, like decades ago? Auto industry. So Flint was the birthplace of cars. General Motors was born in Flint. And the next question's a little harder. So what happened shortly after cars were being made in Flint that really is something that Flint is more famous for? So anybody know this? So shortly after cars were being made, auto workers were like, hey, like this industry is making a lot of money, but we're working really hard. On the days that we make blue cars, we're coughing up blue. And the days we make red cars, we're coughing up red, and we're losing digits, and all these bad things are happening, but this company, General Motors, is making a lot of money. So you guys know what the workers did?
UAW.
You guys got it. So they went on strike, and it was called called the strike that was heard around the world. It was a sit-down strike. So auto workers in Michigan sat down and occupied the car plants for 44 days in the cold Michigan winter. Maybe as cold as your winter is, probably yours is colder. So they sat down and they stopped car production, and they demanded things like living wages and occupational health and safety, and benefits and housing and healthcare and infrastructure and all these things that many folks are still fighting for now. The governor of Michigan intervened, and he called in the National Guard. And it was the last time the National Guard was called in before the water crisis to distribute water. And surprisingly, he called the National Guard to protect the workers. And he recognized their union, and the UAW was born, the United Auto Workers. And what set forth after that was something called the Grand Bargain, where they did get those living wages and benefits. And that deal literally spread throughout the nation and informed wages across the nation. Flint became this almost promised land, where African Americans in the Great Migration North came up to Flint for great living wage jobs. Immigrants all over the world came to Flint for those, once again, great living wage jobs, a great education system, great healthcare, great infrastructure. So it was this is a crazy statistic, and I still am in awe when I say it. But in the 1980s, not even that long ago, Flint had the highest per capita income in the country. Isn't that crazy? The highest per capita, that's not that long ago. We are the poorest city of our size right now. So that history is important because the history that followed is a history that is similar to many post-industrial Rust Belt communities also around here. It's a history of greed, of extreme capitalism, of racism, of neglect. It's a story where people who had the power and the privilege to leave the city left the city. And plants closed and jobs were lost due to automation and outsourcing, and the list goes on of the badness that then happened. And that put Flint in crisis for decades. Literally decades, Flint was in crisis. Every disparity you can think of, Flint had, from infant mortality to asthma rates to life expectancy. Flint lost more than half its population and continues to lose a significant amount of its population. And Flint became a place, like so many in our city that you guys know so well, that where you grow up predicts how you end up. Flint kids have a 20-year different life expectancy than kids in another part of our county, same county, but just another part. There's a 20-year difference. And that's not unique to Flint. You guys know this. That is throughout our nation, where the environment, where the situation of where you grow up, it makes such a huge impact. So Flint was in this terrible state of crisis. And driven by policies, driven by kind of racist real estate practices, all these different issues that made Flint near bankrupt. And this is the most crazy part of the story. Do you guys know what happened to Flint in 2011? We were almost bankrupt as a city. Anybody know what happened in 2011? Yes, good job. So the city was put under financial emergency management. So the state took over the city. So as much as we're going to talk about water and lead and public health, Flint's story is also very much a democracy story, because it is a story of what happens when you usurp democracy from a predominantly majority-minority city. And this emergency manager law was actually voted down by the people of Michigan. There was a statewide ballot, and the people of Michigan said, we don't want an emergency manager law. And it was tweaked in our legislature, which happens to be one of the most gerrymandered legislatures in the country, and it was signed by the governor. So against the will of the people, we had this emergency manager law, and at one point in Michigan, half of our African-American population was under emergency management, compared to just 2% of our white population. So grossly undemocratic and unjust. And it was these emergency managers that were driven by austerity. All they cared about was saving money, that ultimately led to our water switch. So sorry, long history, but history is important. So if you understand kind of that history, that it was policies and practices and, driven by, these often ideologies that kind of put us to where we were today.
So can you expand on where you were about to go, I think, which is the water switch? So for people who aren't familiar with exactly what happened to the water and why lead started leaching into their drinking water, can you just describe what happened there?
Yeah, so the emergency managers decided that the water was too expensive. So anybody from Michigan? Okay, so what do we do when we say where we're from? So show me where you're from. Where are you from? Northville. Okay, so we pulled up our hand because we're the Mitten State, and we point to different cities: Detroit, Ann Arbor, here's Flint, Grand Rapids. We also have an Upper Peninsula that we forget about. But anyways, so this is the Mitten State. That's important. They're important, guys. Sorry. I grew up in the UP. We call it the UP, the U-Burst. Anyways, so what are we surrounded by? What is Michigan surrounded by? The Great Lakes, the largest source of fresh water in the world. 21% of the fresh water in the world is around Michigan, and here's Flint. So for half a century, we were getting our water from Lake Huron. So we were getting our water from, we would buy it from Detroit. It was high quality, pre-treated water. And Detroit just kind of sent it up to Flint, and we would add maybe a little more chlorine, and it was good to go. That was our water for half a century. But under this kind of emergency management, this usurped democracy, this austerity-driven state, the emergency manager said, hey, that's too expensive for this poor, predominantly minority community. We're going to stop getting water from the Great Lakes, and we're going to start getting water from the local Flint River until we build a new pipeline to the Great Lakes. And when the folks in Flint heard that, they're like, what? Like the Flint River? Like, it used to catch on fire. Like, it wasn't just the Cuyahoga River that caught on fire. Like, other rivers were industrial, dumps. I mean, it's a lot cleaner now, thank you, the Clean Water Act. But, it's this toxic, historically, this toxic dump. Nothing as high quality as the Great Lakes. So they decided that's what we were going to do. They were going to change the water source. And in April of 2014, a bunch of men in suits got together and they held up a glass of Flint water and they pressed the button, and our water source was changed in April of 2014. And right away there was problems like color and odor and taste and lots of issues, skin rashes and people's hair falling out. And we had bacteria in the water and boil advisories. So red flag after red flag. And it turned out that our water was missing a really important ingredient called corrosion control, which made it about 20 times more corrosive than the water that we had been getting from the Great Lakes. And it was so corrosive that it ate up our pipes, which have a lot of lead in them. And that's how lead got out of the pipes and got into our drinking water and ultimately into the bodies of our children.
And speaking of getting into the bodies of children, when did you first realize that something was going wrong?
Yeah, that's a great question. So I was hearing the local news of all these concerns about, like, the residents were having about the water, holding jugs of brown water, and they were going to town hall meetings, and these citizens were getting arrested, going to emergency managers who weren't accountable to the people. They were just accountable to the governor, like, weren't listening to them. The moms and the pastors and the journalists, all these people were being kind of dismissed and denied. And I was hearing kind of noise of this, but all the people in charge, like the water experts at the state and the city and and the health experts, everybody was saying the water was fine. For a year and a half, everybody was saying the water was fine, the folks in charge. And in my head, I even pictured them with, like, lab coats, like, and test tubes, checking our water and making sure that it's okay. Because, like, this is Michigan. We're surrounded by Great Lakes, so we have fresh water. And I thought to myself, like, it's the 21st century. Like, we've come a long way in water treatment. Like, civilizations are pretty much built on our ability to deliver clean, sanitized water. But then I also thought, wait, but there's rules and there's laws and there's people who wake up every day to make sure that no matter where you live, that when you turn on your tap, your water is safe. Like, isn't that what government and public health is supposed to be all about? So I was reassured. In some ways, I was drinking the Kool-Aid, and I wish I hadn't. So I was telling a lot of my patients that were coming in with concerns that, like, of course the water is safe. Like, how could it not be? Like, hello, we're in America. Like, we're not in a third world country like this. Like, Great Lakes, of course the water is safe. And that all changed for me when I heard about the possibility of lead being in the water. Because as we just talked about, we all know what lead does, and it's potent, it's irreversible. Like, our kids are already burdened with so much. This is the last thing that they needed. So kind of my life changed about what I heard about lead. But it wasn't anything I was seeing in my patients, because that's the sneaky thing with lead and most environmental health issues. You often don't see acute problems. Kids don't present with, like, headaches and learning problems acutely. There's a time lag between an exposure and the manifestation of symptoms. But it was just the hearing of the word lead that literally changed my life.
So now that you know about it, you knew about it, what happens next? How do you get from knowing about it to now somebody's doing something about it?
Well, I freaked out for a little bit. So I'm like, this can't be. Like, how could this be? Like, our kids already had all these struggles, so many obstacles to their well-being, which is one of the reasons I came to Flint to work as a pediatrician. Like, we were already tackling so many overwhelming disparities, safety and childhood obesity and, a crumbling education system. And, the list goes on and on of all these things. And I'm like, how did this happen? So I was like despondent. I was really sad. I was angry. I went through a roller coaster of emotions when I heard about the possibility of lead. I'm like, lead is, like, literally the oldest and most well-studied poisons known to man. And there's theories that hypothesize the demise of the Romans was because they used so much lead in plumbing, but they also put lead in their food, so not a good idea. So, I'm like, how could this be, like, in this day and age, in this city, in the middle of the Great Lakes? So when I kind of calmed myself down, like, I knew the only path forward was action. I quickly grounded myself with, what my purpose was and what my work is all about. And for me, it's kids. Kids are my why. Kids are why I went to school forever, why I wake up in the morning, why I wrote this book, why I'm here. It's kids, and it's, it's the ability to improve their outcomes. And the neat thing with kind of pediatrics is kind of policy and advocacy are really embedded in what we do. And a lot of our work is prevention focused, be it from the immunizations we give or the conversations about eating right or bike helmets or whatever. It's not so much about the kid in front of us today with the broken wrist, and my daughter has a broken wrist right now, which is ironic, but it's not about the kid in front of us right now, but it's about what they will do and what they will become and their potential. So, knowing that there was lead in the water, potentially diminishing their potential, was a call to action to me to see if there was more lead, in their blood. I never should have had to do this research. There's no reason that research was needed to prove that kids were being poisoned. We knew there was lead in the water. There was great science telling us there was lead in the water. That should have been the hard stop. But nobody was listening. The government wasn't listening and was also dismissing those scientists. So I knew if I was going to try to make any difference, I needed data and science in my pocket.
And speaking of data and science, this comes through really clearly in the book, the important role of science in population health and advocating for improvements to population health. That can be really hard, especially in an anti-science climate, like what we're in now, like what we were when you were fighting against this. So do you have any advice for researchers who are interested in turning their research into evidence that can be used to advocate for public health policies? And is there anything you would change? Would you have done anything differently? What kind of resistance did you get? How do you balance the role of being a pediatrician, a researcher, and an activist?
Oh, that's a wonderful question. And one of the reasons I wrote this book was to share so many lessons that are resonant to where we are today. Not that I could have predicted a pandemic, but it's about kind of disinvestment in public health, and it's about governance that didn't value public health, and it's about the disrespect of science and all these different things. And one of the reasons I think that we're in this kind of bizarro state of science denial is because maybe we as scientists, as academics, haven't been doing a really good job communicating our science, communicating our data. We're really good at publishing in journals that 5 people read. No offense, those are important. We have to do that. Sorry, Dean. We have to publish and do research. But how do we translate our findings, the important stuff that we're doing, to the lay public? And I think we all need better training, but really science and academia as a whole, and how to be better communicators of our science. So that's kind of one recommendation I have. And for me, I was blessed throughout my training as an undergrad in med school and beyond to have had those kinds of preparations. For example, my first opinion piece was in my college newspaper, the Michigan Daily, about the importance of service learning. I had just done an alternative spring break trip. I'm like, oh, this is so cool. The university should fund it. And my last opinion piece was in the New York Times. In my professional training, I had met with legislators and met with policymakers and done things like role-playing on what it's like to talk to a policymaker before you actually go to the state capitol and meet with them about a certain bill. And I had these other opportunities in my professional training to interact with media and journalism. But I think that's maybe a little atypical. I think it's very unique, and I think in pediatrics, and I got additional training in policy. But I think we have to make it part of curricula everywhere. We have to be able to communicate our data and science in non-traditional media, be it social media, be it in opinion pieces, be it in the halls of Capitol, be it on TV. And I don't think that's what we've been trained to do, but need to do more of. When I decided to write a book, I'm like, it could have easily been a science, academic, medicine book. But I'm like, no, I want the lay public to read this. I want everybody to understand science. And I talk about p-values. I'm like, oh my gosh, it's so exciting to talk about p-values. I mean, my favorite blurb on the book is by Oprah, who said it had the gripping intrigue of a Grisham thriller. Who would have thought p-values and statistics and data and research and science would be a page turner. But I think for all of us, it's a lesson on how do we translate the important, amazing work that we are doing in our classrooms and institutions and labs to the public, and to do it quickly. There's this huge gap, this translation gap between when you do science and when it gets implemented in policy. We have to narrow that gap, and I'll give you one quick example. In Flint, part of our recovery is really committed to healthy nutrition. We're like a food swamp, not even a food desert. It's a swamp because there is food, but it's just really bad food out there. High rates of childhood obesity and lead also. If you have poor nutrition, you absorb more lead. So a lot of our work is around healthy nutrition. We started a nutrition prescription program in our clinic, which they're common now throughout, where we give all patients a $15 voucher. It's a prescription printed just like amoxicillin that they fill in the farmer's market. And our pediatric clinic is actually located on the second floor of a farmer's market to address environmental insecurity, food insecurity. I used to tell my patients, like, you need to eat better, eat kale and avocados. And they would just stare at me like, where am I going to get that? And how am I going to afford that? So we as an institution made the decision to move our practice to a place that made access easier. And we give out these nutrition prescriptions, and part of one of my team members is a public health nutritionist. She's amazing. She's a PhD, RD, MPH, who has been assessing this program. She's NIH funded to see does it improve BMI and food security and behaviors and all these different things. And the findings are promising. So we invited our U.S. Senator, Debbie Stabenow, our Michigan Senator, who's a huge champion, to our clinic to see the program and to see what we're doing. She also happened to be the co-sponsor of the U.S. Farm Bill. So she snuck in the U.S. Farm Bill a national nutrition prescription program. And now it's a $25 million USDA program. It's not enough, but it's one example of translating kind of a practice into policy to make a bigger impact.
I have two more questions before we open it up to the audience. And one has to do with the role of the government. So you wrote in the book, I was a true believer when it came to government. I had faith in its ability to protect rights, promote equality, and mitigate historical injustice. The government clearly failed Flint. Do you still feel this way? And do you have a sense of the current community opinion of government and trust in government in Flint?
I think for so many people, when they hear the Flint story, they're like, oh my gosh, failure of government at every level. I think a lot of people come away with that. And for me, I come away with the opposite. Because I just shared a story about one public servant who, when she found out about what was happening in Flint, never stopped fighting for Flint, literally held up the energy bill at one point to get Flint funding. And there's many, many stories of the other kind of governmental leaders who, when they understood the extent and the scope of the injustice, whether or not they were from Michigan or not, some of our greatest allies have been, in other states, recognized the injustice and wanted to do good on behalf. So for me, it's been kind of an affirmation that government can work for people if it is democratic, if it is whole, and Flint's government wasn't. Remember, we were under this kind of state of usurped democracy. So government needs to be representative. It needs to be whole. It needs to be transparent. And it needs to be able to proactively respond to issues like this. And there's been many investigations about what happened in Flint. And there was a task force that the former governor appointed. And they said, one of the root causes of this crisis was kind of this decades-long austerity-driven attack on bureaucracies and government. It was an attack on big government that left many of our public health agencies, like our health department, like our water department, unable to do anything proactive and preventative, and were only able to minimally respond to crises. And you can say the same thing right now about our pandemic response. Our public health infrastructure has been so weakened purposefully because of certain interests that don't want strong regulations, that makes it hard for us to robustly respond to a crisis, but more importantly, to prevent future crises and to keep people healthy. So, I am a firm believer that we need strong government, responsive government, transparent government, and most importantly, representative government.
And the people in Flint, do they trust the government yet?
No, I mean, but it's understandable. It is absolutely. There's a movie that I just watched a screening of about Flint called "Who Do You Trust?" Trust has been absolutely severed in Flint. There's people, no matter what you tell them regarding their drinking water quality, will never touch the water again in Flint. They won't trust anybody. And that's not to be kind of minimized or ridiculed or to say it's anti-science. That's to be understood because of the trauma, really, of that betrayal and of the governmental, not only indifference and neglect, but malfeasance that happened upon them. So trust is going to take a long time to come back. It's going to take accountability and justice. It's going to take long-term resources. It's going to take kind of representation. But, you know, if we also think about the history of Flint, that trust was on shaky ground even before the water crisis, because Flint, you know, felt neglected for so long by people in power. There's some folks in Flint that felt that this was a purposeful genocide. Like, oh, you know, they did this on purpose to get rid of us, you know. So it's going to take a very long time for trust to come back in such situations.
So along those lines, last question before Q&A. So can you give us an update on what's going on since this book came out? What has changed? How are the kids?
Yeah, that's a great question. So it was really hard writing a book, and I think the hardest part about writing the book was in a book, you have to have the end, right? But the story wasn't over. So, you know, I'm like, where should I end the story? I could have kept writing for years. But my editor was like, you need to turn something in. So where we are now is our pipes are almost completely replaced. We had a year delay because of COVID. But they're pretty much all replaced, which is amazing. There's only a couple other cities in the country that have fully replaced their lead pipes. Lansing, Michigan, Madison, Wisconsin. Other cities are now doing it, and some have even finished ahead of us. Newark, New Jersey, after their crisis, also has just completed all their pipe replacement. So our water is absolutely better. But because of the pipe replacement, people are still required to use filtered water and bottled water, because whenever you dig into the ground or move the earth, you have the potential to release more lead from the pipes. So those precautions are still in place, but I'm sure they're going to be removed soon. But my work, I get to spend my every day literally pinching myself to make sure that the kids of Flint have the brightest future possible. So I lead this pediatric public health initiative, which tries to implement secondary prevention measures, which are interventions to, once a population's already been exposed to something, you know, leaning on the science of what we can put into place to mitigate the impact. Like, I wish I could prescribe something to take away this crisis, but that doesn't exist. But there's a lot that we can do to help kids and families and support their health and development. So we have things like brand new childcare centers, and you talked about some of our nutrition programming, huge literacy efforts, parenting support, mental health care, Medicaid expansion, which is probably the biggest gift we got from the federal government. And the list goes on of all these other science-based child health and development promoting interventions. We're also funded by the CDC to implement a Flint registry, which is this massive longitudinal effort to see how folks are doing, but more importantly, to get them connected to services. The CDC just actually included us in their annual budget, so we anticipate doing this work for years, if not decades. And we are starting to get data back from that Flint registry, because I think the most common question I get asked is like, how are the kids doing? And it's, I can tell you how some kids are doing in clinic, but like that's not what you want to know. You want to know how the population is doing. That's the work of like epidemiologists, which we all know about now. You know, the kids are okay, you know, so they have challenges with things like cognition and behavior. There's a lot of need for neurodevelopmental assessments. There's been an increase in special education services, you know, a drop in literacy rates. So it's very difficult in all environmental health things to prove causation, but that's not our job. Our job is to see how folks are doing and to support them as much as we can. So this is long-term work, and a big part of my job is the work in advocacy and policy to make sure that future Flints don't happen. You know, writing this book and talking to you guys and you know, working with policymakers. You know, Flint never should have happened, but Flint's case wasn't the first, it wasn't the worst, and it wasn't the last. So there's a lot that we can do from learning the lessons of Flint to make sure that there aren't future Flints. And I think the most exciting development is the National Infrastructure Bill. So President Biden's infrastructure bill includes the removal of all of our nation's lead pipes. Like, this is amazing. This is something that folks have been working on for a long time. I had a chance to testify before Congress a few months ago on my phone, which was bizarre, about the importance of removing these lead pipes. And there's about 10 to 11 million lead pipes in the country. There's a cost of inaction. We work really closely with healthcare economists, lead economists, who even have put a price tag on our inaction when it comes to special education costs and criminal justice costs and decreased economic productivity. So not only does it make health sense, it also makes kind of economic sense why this should be happening. So we're really excited. It was included kind of in the House bill. So fingers crossed that this will get passed soon.
It's great. Potentially very good news. So thank you for the really wonderful overview of the book. I'd like to open it up to the audience now. Laura is moving a microphone to the center if folks want to go up there to ask their question. And Laura, do you plan to read anything coming through on the Q&A? Okay. So what are you interested to know about? Yes, please.
I'll go first. Hi, I'm Kennedy. I'm a first-year undergrad student at SU.
Awesome.
My question is, currently in my anthropology and my introduction to Native American Studies class, a lot of emphasis has been placed on ensuring that researchers and policymakers portray those that they're seeking to help in different communities, like that they don't have any connection to truly, with accuracy and cultural competence. I was just curious, how did you navigate the differences between yourself and those you help in areas such as Flint, Michigan?
That's a really great question. So Kennedy?
Yeah.
So Kennedy's question was about how did you navigate the differences between yourself and the people that you're trying to help, trying to portray. And it was complicated. So I don't live in Flint. I work in Flint. I'm not white. I'm not black. I'm this weird brown immigrant that's come there as a pediatrician. And I was very kind of clear up front that I'm not telling anybody's story. I'm telling my story, and my story is just one of many narratives that need to be shared. So that's kind of how I explained it a little bit in the text. But in our work, in my daily kind of work in the community, everything is done hand in hand in humble partnership with the community. So Michigan State University's public health programming is actually based in Flint. And it was created several years ago. This is one of the reasons I came back to Flint. They asked the community, they're like, if we're gonna come and build public health programming here in Flint, what do you want us to work on? So they did thousands and thousands of surveys and town hall meetings and what have you. And the community identified 3 big areas: healthy behaviors, behavioral health, and chronic diseases. And based on what the community wanted, they hired translation researchers, not to study the community, but to implement interventions to reduce disparities. So that's kind of how the university was created in Flint in terms of public health. But the university as a whole is also a land-grant university that has had a footprint in the community for over a century, and always kind of driven to service and to working with the community. So that's kind of the background of that. And then when we created our initiative, we also knew how important this work was to be done with community. That's important in every impacted community that you're working in, but it's especially important in Flint's story because, once again, Flint's story is a story of usurped democracy, where the people of Flint were loud and heroic and organized and saying, there's something wrong with my water, why aren't you listening to me? So kind of central to our recovery is the inclusion of participatory democracy and self-determination. So we've kind of formalized that in several ways. I have a parent partner group, a group of parents that we routinely meet with, and they represent every ward of the city and their moms and dads and foster parents and grandparents that we sit with. And it's really hard because I have to close my mouth, and I love talking, and I just listen. I just listen what people are concerned about, what they want addressed. And then we've taken it a step further, and this is my favorite thing ever. We have a group of kids that advise us. And they've named themselves the Flint Youth Justice League. And they're a badass group of kids, ranging from like 8 to 18, who tell us once again, like, what's important to them. Shortly after Flint's crisis happened, I mentioned there was a similar crisis in Newark, New Jersey. So our Flint kids Zoomed with kids in Newark, New Jersey to tell them what they should be advocating for, what's a safe part per billion level, like different kind of tips. So these are very deliberate efforts to elevate the voices of others. We also have, for example, a director of community engagement and implementation who's part of our leadership team. And then our Flint Registry is this massive project. It's like a $20 million CDC-funded project. And so many other universities or other folks are like, we'll do this for you. We'll run your registry. Like, this is the kind of work that we do. And we're like, go away. We can do this. And the registry is located in downtown Flint. And we are committed to hiring and training and building a Flint workforce. Because we also know that central to health is also economic development. People, I wish I could prescribe like living wage jobs for parents. We have an over 60% child poverty rate in Flint. So we're also committed to kind of building and training a workforce. So these are just some of the things that we've tried to include the impact of community and do our work in a very community participatory, community-driven, community-informed way.
It's fantastic. Yeah, Laura?
Some questions from the chat. The first is, do you worry that what happened in Flint is still happening in underserved communities in the U.S.?
Yeah, it's happening right now. So there's another city actually in Michigan, Benton Harbor, Michigan. The NRDC, this amazing group of environmental lawyers, has just filed a petition that I signed on to the EPA to take emergency action. For 3.5 consecutive years, they've had violations of the action level, the lead and water action level. It is happening all over, and nothing maybe to the extent that it happened in Flint. But before Flint, there was an even worse lead and water crisis in Washington, D.C. in the early 2000s, that lasted longer with even higher levels. So as long as we continue to have lead in our drinking water infrastructure, there's going to be exposures. And if you think about it, like somebody from the EPA told me, it's like, our pipes are like straws. Like they're like straws, right? And we're literally like drinking through these lead straws. And if we respect the science that there's no safe level of lead, we need to get the lead out. And so that's why I'm so excited about the infrastructure bill, which will finally remove the lead from our service lines.
Claire, and then over here, and then Len, did you have your hand up?
Thanks. Hi, thank you so much for being here. It sounds like the emergency management law was a huge part of kind of the structural enablers. Is it still in place, and does it exist in other states? And has that been part of the advocacy push to change the policy environment to keep it from happening again?
Yeah, that's a really great question. So yes, the emergency management law was a determinant of this crisis. Like, it was a causative factor. It is still on the books, so it is still a law in Michigan, but there's no other city anymore that's under emergency management. But the law needs to be removed. There are similar kind of receivership laws in other states, but nothing, to my understanding, that is really kind of as egregious as the one that was in Michigan. After the water crisis became a national story, there was congressional hearings, and the emergency manager was subpoenaed to testify before Congress, and he testified before Elijah Cummings, who has since passed away, who was the chair of the Oversight Committee. And Representative Cummings asked something like to the emergency manager, why didn't you listen to the people? Like, they were coming to you literally with jugs of brown water and all these concerns, and they had done all the citizen science. Why? Why didn't you listen? And his response was something like, I didn't have to. I wasn't accountable to them. So kind of let this serve as an example of the consequences of eroded democracy or corroded democracy. And it's not an isolated thing. Like, turn on the news. These are things that are happening right now, be it voter ID laws or voter suppression laws. These are all the same kind of efforts that are taking away people's voices from the table.
Yeah, hi, I'm Rachel. I'm an MBA student. I actually had the chance to meet you in 2016. Well, I was at Michigan State University.
Yay, I
so
remember.
I'm sure. But I was very excited to see that you were coming to campus. And my question is, especially just in light of what we're going through right now with COVID-19, what advice do you have for people early in their careers in public leadership, especially those of us that do not have expertise in public health?
Awesome. That is a great, great question. And I have 4 bits of advice, especially for the young folks who you guys inspire me. Like, you care so much. You have been on the front lines, fighting for democracy and equality and, sick of the status quo. So I am always so excited when I interact with you because literally you guys give me energy. And I think there's like 4 little bits of advice that I try to kind of come up with. And one is to find your passion, to find your purpose, to find what grounds you. And for me, I told you, like, my why is kids. Like, that's literally like why I wake up. So find your thing. Like, what is it that like you really care about? And there's like a long list of things you can care about, like immigration or kind of women's reproductive rights or climate crisis, like whatever, democracy. What is your why? So find your passion, and then find your peeps, find your people. So this story is not about one person. It is about a team. And it is about an unexpected team that came together that helped not only expose this crisis, but work together in recovery. And for so long, like before this crisis, I was an academic pediatrician and a medical educator. I hung out with lots of other pediatricians, and we kind of thought we had a monopoly on caring for kids. Like, who else cares about kids more than we do? And what I loved learning throughout this crisis, how wrong I was. Because, oh my gosh, so do geographers, and so do sociologists, and so do economists, and so do teachers, and so do social workers, and so do all these other folks. So you are at a place where I know you have incredible interdisciplinary experience. Take all of that in, because you need all of these different lenses to ask different questions and to come up with different solutions. So, and they're going to be in unexpected places. Like, I never thought my best friend would be a water engineer. Like, what? Like, who knew? Like, we couldn't have been more different people. But we both cared about the same thing. You need those peeps. You need people, because it's exhausting work. It is hard. There's ups and downs. And you need people who have your back when you're low, and when they're down, you need to be there to lift them up. So find your peeps. Don't reinvent the wheel. They're there. I think so often I think we feel like we are shouldering the burden of all the world's problems on our own, but there's other folks out there that care about the same things that you do. So your passion, your purpose, find your peeps, be persistent. So you guys know this. So, policy making especially happens in windows, and you never know when those windows are going to be. So you got to be persistent and, play the long game. Keep at it. Be persistent. And I like to add, be pleasantly persistent. So it may be annoyingly persistent. So, I was really good at that. So just be persistent. Keep at it. Don't give up. And then my last kind of bit of advice is be prepared. So I mentioned a little bit about kind of my preparation, and I think there's a line in my book, like I was the right person at the right place with the right team, but also the right training. And you guys are once again in this amazing place to get a lot of these different skills. And you never know when these skills will come in handy. Like I did drama in high school, and I'm like, people are like, well, why do you like enjoy public speaking, or how do you know how to project? I'm like, I think it's because I did drama in high school. Or like, so take advantage of like these amazing opportunities that you have in a very safe space to learn different skills and to get as much of a well-rounded experience as possible. So passion, purpose, people, your peeps, persistence, and be prepared. So try to kind of hold on to those things.
Great advice.
Thanks very much for coming, and thank you even more for the work that you're doing. It's really inspirational to hear about what you've done in your experience. I'm curious about lessons that we can learn from your experience in other contexts. I'm from South Louisiana, which not far from a place that we call Cancer Alley, which has some of the highest cancer rates, certainly in the country. It seems like, well, I'm curious, you've mentioned a bunch of things. I mean, clearly you and your team had a lot of the advice that you just gave. You had a university in your backyard. You have a community that was very influential and important. I'm wondering what kind of the key ingredients are, because it did seem to take off there. You have a lot of media attention. Maybe it was partly, again, some of the skills of the people there. But there are lots of environmental crises. What can we learn from what you did that made, for the sort of success that you've had that we can take into other areas?
That's a really great question. And, I've spoken with so many other people, and they're like, we've been battling this environmental injustice for over a decade. Like, why did yours get fixed, or is in process of getting fixed so quickly? And I think it was a perfect storm of a lot of things that definitely, highlighted this and made it an international story. And speaking to that is the role of journalism and media. So if there's one thing that you can do is to support increased recognition of these kind of issues, is subscribe to your local paper. Like, we need more investigative journalists. Investigative journalists are the unsung heroes of the story. They were digging and digging and digging and asking questions and digging, and I would have been nowhere without kind of their previous articles that were telling kind of us what was going on. Unfortunately, we live in a time where we don't have as many print journalists. There aren't as many, investigative reporters. But one thing that you can do is partner, with media, with journalists. Recently, Flint hosted the Society of Environmental Journalists National Conference, and journalists are eager to kind of make connections in academia and also in community. So that's one recommendation that we haven't talked about, is definitely kind of make partnerships with the people that can really highlight and bring these issues to light. And then lastly, and you touched on this, is the role of academia. All of us as academics are affiliated with the universities or institutions, and we may not think it, but we have a lot of credibility. Like, we carry a lot of weight. We have a lot of power in our voice and our background and our skill sets, and our communities are yearning to work with us. Like, they want to be able to have that connection with academia. So, try to find, the community. I mean, I don't know how you can advertise it, but try to, be available to community when an issue comes up. In the beginning of the Flint water crisis, a year and a half before I got involved, community members went to different universities in our state, and they said, help us. They're like, oh, we're not funded for this. We have no time. We have no effort to do this. That's not what science is about. Science also has to create the incentives for flexibility and academic freedom to be able to do things that may not be part of your kind of effort allocation, but that's still really important for your community. So I think those are kind of two quick things. I think the last is the power of storytelling. I shared in this book, but it's something that I do every day. I have sat in many offices of folks in DC, in our state capitol, and I talk science. I'm really good at talking science. I can tell them a lot about lead and the statistics and what needs to be done, and you can literally see eyes glaze over when you talk science, like literally eyes glaze over. But when I start talking people and children and their stories, it's, I get a different response. The last time I testified, like I said, before Congress a few months ago, it was on my phone, which was bizarre, but I started with a story. I held up a pipe of a family. It was the Brown family, and the Browns, Oscar and Elizabeth Brown, moved to Flint in the 1950s from Alabama. They were part of that great migration north. And they came to Flint, and they first could only live in a black-only neighborhood. And he worked at Buick, and he got a pension, and he raised generations of his family in this home, finally moved to another part of Flint. And their great-grandchild lived with them and drank water from this pipe and subsequently suffered seizures and all these health problems. And I talked about that American promise, how here was that promise of folks trying to flee somewhere with so much oppression and racism to go somewhere better for not just themselves, but for future generations. And yet we had failed them again by this injustice. So when I told that story, people paid attention to me more than when I told them about like the pathophysiology of lead. So partner with your communications departments, or you know, go to different workshops. But there is definitely a power to storytelling.
Hi, thank you so much for your time today. My question is regarding the possibility of resurgent lead exposure from legacy pollutants in the city of Flint, Michigan. In a city like Syracuse, some of the most persistent sources of lead poisoning is coming from lead paint dust in substandard housing, as well as soil which has been contaminated from decades of leaded gasoline.
Mm-hmm.
So essentially, I'm curious what the city of Flint has done to address some of these other sources of lead exposure, and if those policies can serve as a model for other cities like Syracuse.
Yes. Oh my gosh, it's like you planted that question. I love that question. So after Flint happened, the state applied for a waiver from CMS, so the Center for Medicaid and Medicaid, to do primary prevention, lead inspection, and abatement. So it was the first time that healthcare dollars were to be used to fund home inspections holistically to look for lead paint in the dust and soil and what have you. And then if they found lead, healthcare dollars were used to fix it and even put up a family in a hotel until it was fixed. So Michigan got this waiver, so it was done at the state level, not at the city level. And for the first time, it was not dependent on a kid having an elevated lead level. That's usually how it works. As pediatricians, kids come in for their checkups at the ages of 1 and 2. We check their lead because that's developmentally when kids are walking and crawling and they explore the world by putting everything in their mouth. And that's when they're most at risk for lead paint and dust and soil. And when we find an elevated lead in that kid, that's what prompts those environmental investigations and abatement. But you know what? That's backwards. That is ridiculous, and it is literally using children as detectors of environmental contamination. But that's how it has been done and how it continues to be done in most places. That's not primary prevention, because once you find lead already in that kid, it is too late. So as a nation, we need to do a better job screening environments before kids are exposed. And this is exactly what this waiver did and continues to do. After Michigan got this waiver, several other states have also gotten this waiver, including, I think, Maryland and Illinois, but I'm not sure, and I don't know if New York has gotten it, but it's still an option to really focus on primary prevention, to, once again, find the lead in the environment before kids are exposed. There's also some other best practices that in other communities. I think it's Buffalo that does some really great work with rental inspections, making sure that at the point of home transfer, a real lead investigation happens before a kid or a family moves in. So there are things that can be done, and those things have also been shown to be cost effective.
We have a couple questions from the live stream. The first one is, are there plans in place or in the works to provide support for Flint children affected by lead as they age into adulthood and lose supportive schools or even move out of the area?
Oh, that is a great question. So yes, there are plans in place, but nothing that's kind of fully resourced. to support folks. The Flint Registry is one of those longitudinal plans to see how folks are doing and to get them into the services like mental health care or neurodevelopmental assessments. Part of kind of the remediation or long-term support is also being sought out through our justice system. So this is something we haven't talked about yet. There was criminal cases as well as civil cases in Flint, and they're all kind of still ongoing. There was a settlement in the civil cases, like an over $600 million state settlement, which is the settlement that the state has ever had, to provide for damages to folks that were injured. It's very complicated, and it's once again still in process, but the priority of those dollars, the majority of those dollars do go to children, and there's also kind of a part of that fund set aside for future needs. So that's one part of it. And then the other part of justice is the criminal cases, which are in process, and there's been many charges filed against folks that were involved, from the emergency managers to our former governor to the former head of our health department, water officials. Included in those charges are also homicide charges, because in addition to lead, we also had an outbreak of Legionnaire's disease because of the untreated water, and people died from that. But that's also a mess and in process. Lastly, the other kind of effort to support folks long-term is the Flint Kids Fund, which I helped create. This is at our community foundation. It is kind of our 20-year fund to support kids and families. We've been able to raise over $20 million, which is amazing. We've given out about $11 million to support a lot of the things I talked about, like home visiting programs and breastfeeding and literacy and all these other support programs. But there's still a need for long-term supports. And the things that we're talking about, these support things that we're talking about, like, they sound amazing, but they're like common sense. Like, all children need these things. Like, all kids need health care and food and, education and early child care. Like, this is not rocket science. These are things that all kids need.
Another one from the live stream is, could we even pass the federal laws that ended the widespread use of lead today, given what the pandemic has revealed regarding politics, science, and public health? Would what worked before work now?
I'm hopeful. I am also this eternal optimist. Flint's lessons are some of the exact same lessons as the pandemic lessons. It's about, once again, kind of good governance that values public health, about respecting science, about proactive investment in public health, and about equity and disparities and who's impacted by what crises. For a long time, we've been trying to share these lessons from Flint, but now the whole nation's kind of going through the same kind of experience. I'm hopeful that the whole nation is also learning that, hey, we need good leaders that value public health. So I got lots of eyes rolling. That we need to respect science. That we have to invest in what keeps people healthy rather than continue to pay so much to treating them after they're sick. We fund a sickness care system. We don't fund a health system. And that we have to address things like inequities, because once again, the burden of things like the pandemic, and I know you can speak to this even more, and things like the environmental issues don't fall equally on all populations. So all of these lessons that the nation's learning gives me hope, and I see it already in some policies. I see it in, for example, the child tax credit. Like, this is amazing. This is like the biggest thing that has happened for kids in generations, this effort to lift children out of poverty. It's temporary, needs to be permanent. But I see it in some of the increased funding that's gone to public health agencies and things like the CDC. I see it in the infrastructure bill and the plans to support things like, family leave and all these other things. So it's, raising the minimum wage and benefits. So can we sustain some of these things? That's the question. And I think, time will tell, but I'm hopeful that we learn some of these lessons. I had a chance to write an article for the New York Times. It was like a year ago, which was premature, but it's like, as we envision the post-pandemic era, like how do we build an America that we need, that's more fair, more resilient, more just? And my whole article was about, how do we truly invest in what keeps people healthy? like universal childcare, like raised minimum wages, like stronger environmental health regulations, like family leave policies. These are the things that that truly make people healthy, that so many of our communities and children especially don't have. So once again, I'm hopeful, but we have to keep being activists and keep being civically engaged, keep voting, keep talking to our policymakers, run for office, do all these different things that can hopefully improve the lives, especially of the most vulnerable. This is all about civic engagement, right? It is.
Do you have more, Laura?
Yes. In your book, you speak about resiliency. How should researchers think about resiliency, and how should we start to build resiliency in our communities in light of COVID-19?
Yeah, I think that's definitely related to the last response. My article in the New York Times was actually called "I'm sick of asking children to be resilient," because so much of what we do in Flint is on the shoulders of those that are impacted. It's very much kind of a blame the victim, like, oh, you were exposed to this bad thing, read more to your kid and do this mental health program and fill this nutrition prescription. Building resilience needs to happen at the community, policy, country level. We need to put into place the structures that create, resilient communities, rather than assuming that children who are burdened with so much can rise up and overcome these insurmountable obstacles.
What do you say to the medical community as a physician about your role in activism? Like, I'm sure you hear this, stay in your lane, this is not the role of a physician. And what do you see are like some strategies to kind of bring more people along with you in the medical community?
That's a great question. So it was the question about doctors being activists, and people are like, oh, this is probably not what you expected that your career was going to be like. I'm like, no, this is exactly what I expected my career to be like. This is why I went into medicine. My job is I'm a clinician. I still see patients. I'm a researcher. I'm an academic, and I am an activist. It's literally part of my job description. As much as I understand kind of the biomedical of what makes my patients sick, I also understand that their geography and their histories and there's hierarchies that also manifest in their bodies as if their lives don't matter. And that also fills our hospitals and our exam rooms. So this is my lane, and this has been my lane. And I am privileged to continue to teach medical students, and I get to talk to medical students all the time, and older docs who are harder to convince. But this is why this is what medicine is all about. And one of the lessons of the story is that when the doctor spoke, things happened. And once again, that's not what it should have happened. Once again, the first mom that said there's something wrong, it should have ended. But when the person with the long white coat and all those degrees after her name said something, it carried weight and credibility. So what I kind of impart to doctors is that you are so well respected, especially in the era where so many professions are not well respected. Use that power and that voice for good. And I'm so excited by what I have been seeing. Never before, I think, in medicine have we had so much discussion about racism as a public health issue, about kind of the historic practices of medicine, the medical, there's medical bodies in this country that have not, done good things. There's lots of amazing stories. The Mortal Life of Henrietta Lacks, the Tuskegee experiments. The medical system and medical institutions have also do need to come to reckoning kind of with their past, and I see that beginning to happen. For example, the American Medical Association, the AMA, recently kind of released an apology for bad things that happened decades ago, and the American Academy of Pediatrics said, oh, we never should have. We should have given these people membership to the organization decades ago, but we didn't. So there's a reckoning that I think is happening in the medical community, and I think with COVID, I hope doctors are beginning to understand that there's only a limit to what we can do. There's not enough ventilators or ICUs that can care for our patients. We need, once again, to go upstream and to address kind of the policies and the actions that are making our patients sick. And it's been wonderful for me to see doctors that I never thought would speak out are speaking out. They're active in their school boards now, and they're running for office, or they're doing all these wonderfully civically engaged things with their voice as a physician to hopefully keep more folks healthy. But more needs to be done. There needs to be more curricula on advocacy and media training and legislative training and all these different things so that doctors understand that this is their lane too.
Well, and just to jump in, because you bring up training, I was struck by the way that you train your first-year residents. So maybe you could tell folks who haven't read the book about what you do with them, but part of it sounded like an ethnography, right? You send them out into the community to chat with people and see what's going on.
I run a rotation called Community Pediatrics, where we do everything we can not to be in the hospital. So we take a city tour, we learn about Flint history, we meet with policymakers, we go to the court system, we do school visits and home visits, and we kind of map out how much graffiti and blight. And so I try to get my students to understand where our patients are coming from, not only the challenges but the strengths, and to try to get them to understand that the illness that they present with is a manifestation of so many of these other uncontrollable factors in their lives. So I think pediatrics is kind of really good in that respect, to try to expose folks to things that are outside of the exam room in the hospital. One of the reasons the book is called What the Eyes Don't See is doctors can be very myopic. Like, we're just often really good at seeing what's in front of us. There's a poem that I include, and I'll read it. It kind of carries this message better than I ever could. So it's a poem written in 1937. It's called A Worker's Speech to a Doctor, and it's a poem that I give my students, and I include it in the book. And it says, "When we're sick, we hear, you are the one who will heal us. When we come to you, our rags are torn off, and you tap around our naked bodies. As to the cause of our sickness, a glance at our rags would tell you more. It is the same cause that wears out our bodies and our clothes." So that was written in 1937. We've obviously come a long way since 1937, but in so many respects, this still very much rings true.
We have one more question from the chat. Can community members guide or locally co-create large-scale infrastructure remediation plans as Biden's plan might opportune?
Absolutely. I hope that the resources come in to do infrastructure improvements, go to local communities, hire local workforces, and are done in a way that the community wants them to be done. This is once again about the need to be kind of community informed and driven and participatory. So one question I got when I testified before Congress about the pipe replacement was from a representative who said, how quickly do you think all our nation's pipes should be replaced? I'm like, well, it took a long time to put them in the ground. It's going to take a long time to get them out. And a lot of folks are looking at a 10-year window. And she's like, well, do you think that's going to be enough time to be able to train local workforces to do this? Because we want to make sure that we do this in an equitable way so that we're also providing these living wage union jobs to some of the most impacted people. I think that's possible. I hope that is possible. And I think examples like in Flint and Newark, where this large-scale infrastructure work has happened in a fairly short period, also speaks to that.
Well, I think that's an excellent place to end on hope. And I want to thank you so much for being here. What you've done with your work is truly inspirational. And I'm glad that you've shared your story with us.
Thank you, Shannon. It's great to be here. Thanks, everyone.